Hi everyone, this is Dr. Jordan, and this is week 1 of HCI 302, Healthcare Safety and Quality. And I wanted to just give you an introduction to what we are talking about when we say healthcare quality. Now, of course, many of you are going to think automatically and quickly about patient quality, that we're taking care of our patients well, that they're improving, that we are providing the right medications at the right time, that the procedures we're doing are free of errors, and help actually improve the patient's overall health. And you would be right. That is definitely part of healthcare quality. But quality encompasses a lot more when we're discussing a healthcare organization. So what are some of those other points that we want to include in our conversations about quality? We certainly want to talk about processes. So things like checking in a patient from the emergency room or through same-day surgery, or how we do pre-authorizations for procedures to make sure the insurance company is going to pay. How we move a patient from floor to floor or from department to department. All of those things are internal processes, right? How we get things done inside the hospital or the nursing home or physician's office. So quality encompasses all processes within an organization, and those can affect many things, including efficiency, including cost, including patient satisfaction, as well as the outcomes of patient health care. So all of those things are included in processes. We also want to talk about quality in terms of customer service. So in healthcare, patients and their families are our customers. And it's important that we remember that they are customers as well as those needing healthcare. So customer service is important in terms of how the frontline staff greets a patient, how they talk to them on the phone. Some of those efficiencies we talked about involved in processes, those really reflect strongly in customer service. So we want to have quality initiatives and quality control and always looking at ways to improve the quality of our customer service to our patients and their families. Because it's not just a business decision in terms of we want to get more patients so we can earn more money. It's also a quality of life issue. You will discover in your research around patient quality and safety that patient satisfaction, customer service indicators relates very strongly to the overall satisfaction of a healthcare encounter. So those are crucial quality indicators we want to focus on as well. And then let's talk a little bit about internal quality. So what I mean about that is how we get along as staff, physicians, and other employees of a healthcare organization. The internal quality of how we communicate with each other, the level of policies and procedures that we're involved with, our collaboration between departments, our trust in each other as professionals, and all of those sort of hidden from the patient at least, or hopefully is hidden from the patient, but that internal conversation and our culture inside a healthcare organization is very closely tied to quality and how we can excuse me, improve our own quality of communication and internal customer service in a healthcare organization has a big effect on how we do our daily jobs. So can you imagine really disliking your fellow employees, being afraid or really disliking your boss? Not understanding the policies that you work with, feeling like procedures are inefficient and ineffective and causing problems in your daily job. Can you imagine how those feelings inside of you reflect back to the patients and the customers that we serve? They do. They very much do. So, and when we talk about internal quality, we really want to focus on the quality of our entire organization, how we treat each other, how we write policies, how we include each other in decision making and collaboration. Because I think we all know the more involved you are in designing a policy or helping to make decisions at your organization, the more likely you're going to feel like a valued and important employee. So all of these items, patient care, processes, customer service, as well as our internal organizational quality, all relate to healthcare quality. And you will see throughout the course how these things affect patient care, patient outcomes, and the overall operation of a healthcare organization. So I hope you enjoy learning about these and keep these sort of bigger topics in mind as we move forward throughout the course. Now, in week one, we're going to talk about the 6 dimensions of quality and what they actually mean to help us define how do we know when we've achieved a level of quality that we are happy with, and how do we measure when we've done better. So that will follow shortly after this introduction. Thank you.